Dr. Cook, thank you for being here today. This is our spotlight series. We want people to understand what medicine is, what surgeons do, how much work goes behind the scenes to do what you do, and the level of responsibility that you have. It's supposed to be a light conversation. I would love if you can introduce yourself, tell me the name of your practice, and we can jump right into a little bit of the story how you became a surgeon, DPM.
Be my pleasure, Diogo. Thanks for having me on. My name is Dr. Michael Cook. My office and practice is Michael R. Cook DPM LLC. Been My background is I'm born and raised here in Miami. I was born in South Miami Hospital. I've been on staff there for the past 40 years. I love what I do. My father always told me that if you enjoy what you do, then you won't work a day in your life. And he was right. So I really enjoy what I do. There's nothing like having a patient come in with a particular problem and then having them feel better in solving their problems when you're done. So I just enjoy what I do every day.
Amazing, amazing. Tell us a little bit of the journey. How was it studying, the preparation, and everything that goes behind the scenes?
Um, I met First off, I met many people on my journey from undergraduate studies. I went to the University of Florida. I was a chemistry major. Um, um, I was in a fraternity, and in my fraternity was a fraternity brother who was going to become a podiatrist. I was actually pre-dent when I was at school, and I was planning on being a dentist. And my fraternity brother talked me into becoming a podiatrist because he was going to become a podiatrist. His father was a podiatrist. His brother was in podiatry school. He ended up marrying one of our classmates in school. So the whole podiatry door opened up, and I didn't know anything about it until I actually went to visit and spend time in a podiatrist's office in Gainesville. And once I did, I never looked back. I found it fascinating. I loved the fact that patients would again come to you with a particular problem, and you can certainly help them out, gain their mobility and independence and functionality. There was nothing like it. So from there, went to Cleveland, Ohio. I attended the Ohio College of Podiatric Medicine. It was a 4-year program, and when I was done with that, I went to Flint, Michigan, and rotated between 2 hospitals for my surgical residency training program. And when I was done with that, I came, of course, back to Miami, my hometown, and I've been practicing here for July will be 40 years. It is a journey. Nothing happens overnight. There's a lot of work involved in order to get to the point where you're able to start, practicing what you learned. But I thank my fraternity brother every day for talking me into going into podiatry, because I couldn't imagine doing anything else, other than being a professional golfer, and I'm not that good at golf. So
Yeah.
that's out. But I've always enjoyed it. There's always challenges, um, but the process of going through what I went through, and as you're going through it, there are difficult times. There's a lot of work that's involved. Especially the work in podiatry school. It's voluminous. The hours spent just trying to gain the knowledge and going through the testing. And then, as I said, testing, I take a test every quarter now just to regain my status as a board certified surgeon, which I am. Been board certified for over 30 years. And every quarter we're required to take an exam. So the tests and the education never ends. Even to renew my Florida license, which is where I practice here in Miami, I have to get continuing medical education credits, 40 hours every 2 years. So the constant education it never ends. And there may be certain things that I'll see on a daily basis, um, over and over again. I don't get bored with it, but every now and again something new will come in, and I'll look and I'll kind of be excited about it, you
Yeah.
know.
So I brought it up on purpose because for the listener, I was talking to Dr. Cook and I mentioned something recently, and he mentions like all like new researches. So I like to bring up this aspect of people don't know how much work goes behind the scene and how much studying and staying up to date you have to do, because it's not like just punching in and start working for the next 40 years. Like you have to continue improving and learning. My grandpa was an orthopedic surgeon, and he had a library in the house that was a dream to me because I'm obsessed with books. Like I could spend all my money on books. Like I'm an avid reader and I'm a nerd, and that's what inspired me to have something in my
I
house.
see all the books
Oh
behind you.
yeah, and he was the inspiration. But I remember in my childhood, he would get home and lock himself in his office for like 3 hours every single day, and you know, I'm not entirely sure like what vision, like what's the view that people have of, surgeons, physicians, people in the healthcare field. But like I said, I love highlighting like how much work it holds behind the scenes, and it's that archetype of the healer, because honestly, you're doing it for your patients, like there's obviously pride on being excellent at what you do. And I know how passionate you are about your profession. But then when you're exhausted, when you're having a bad week, when things go sideways on the insurance side and reimbursement, like you're actually, going through so many blocks that to deliver excellence that people never see those things.
Yeah,
So it's great to hear that you don't see yourself doing anything else, and your dad is absolutely right. Do what you love, and you don't have to work live your life.
that's
But
right.
that doesn't mean it comes without challenge, right?
That's correct.
So for someone, people they may hear podiatry and think, is it pediatrics? Give us an idea, like podiatry, like what is the focus of what you do, and tell us a little bit, like if there is like a misconception that you see like daily, people come with an idea and they're like, hey, that's not how it is.
Um, well, I'm a podiatrist. Uh, so that I spent my specialty is foot and ankle. I've been trained to diagnose problems, understand them, and offer the best possible treatment for my patients to get them, back to feeling good and regaining their independence and functionality. So,
Awesome. How many times have you had to like reconstruct a foot and an ankle post
oh
after fracture and stuff?
yeah. Quite a few times. There, um, most of what I like to do is mainly forefoot reconstruction. There are, injuries that occur. One of the more common injuries that needs to be, if it's displaced, if it's a displaced fracture or fifth metatarsal fractures, Jones fractures, the styloid process of the fifth metatarsal. Those are all very common injuries with when someone will kind of twist, turn or roll their foot or ankle. And once those bones are broken, they don't heal very well because they have a poor blood supply. So they have to be surgically repaired. They have to be placed in their proper position, either with multiple screws, one screw, or plates. So there's those are the trauma that may require surgical intervention. But most of what I do now, and I treat everything, but surgically I'll treat bunions, hammer toes, um, uh, plantar plate disruptions, extensor tendon contractures, neuromas, which are inflamed nerves between the toes. Um, in the office, there are simple things that can be done for less severe problems like ingrown nails, wart excisions, things of that nature can be done in the office. But I've been doing forefoot reconstruction for many years.
Amazing. Awesome. Let's I'm gonna just throw something as an example. I've had patients answer the phone and say, I'm at the masseuse, and I cringe. I went to school for 6 years.
Yeah.
So what are some of the misconceptions that you get that you be able to clarify?
Yeah, the podiatrists are able to run the entire gamut of getting someone better. They can prescribe medication. They can do surgery. They can inject medication. So we have the same scope of practice, just designed to treat foot and ankle, as an orthopedist may have. Now, an orthopedist can treat shoulders and hips and knees, etc. But when it comes to specializing in foot and ankle, that's all we do. So we are able to do everything anyone else could do, and we know more about it than anyone, because that's what we were trained to learn, what we were trained to diagnose, and what we were trained to treat. So we're able to do quite a few things. We Many years ago, this profession used to be called chiropody. That must have been, and I'm not a historian, but I'm going to say it was probably 75 years ago, when there were chiropodists, and then it was changed to podiatrists. Now, chiropodists would basically just be able to trim corns and calluses and toenails. They were also able to treat the hands. But then it evolved into podiatry, and we became podiatrists, and podiatrists are able to do everything else. So again, prescribe medication, inject, do surgery, things of that nature, and we're able to focus directly on the foot and ankle problems that people present with.
Amazing, amazing. I'm gonna dig in a little bit of what you said, because my grandpa used to tell me that Dr. Bunnell made hand a specialty, because after war they were doing reconstructive surgeries, and the hand were the ones with the worst outcomes because of how complicated it is. And I know, because we treat and rehab foot and ankle, so I know how complicated it is.
Yes.
So it's really amazing that you guys can like laser focus on one body part like that, because it's really hard to do well everything. Like, it's extremely complicated, like the angles of biomechanics, and understand like torsional forces and compressive forces. And it's really amazing that podiatrists can focus and be so detailed like that about one body part. Is really amazing.
It's what makes us a specialty. There's 26 bones in the foot and 33 joints and multiple ligaments. And you need to know your anatomy, but you also need to know really everything. And you need to know dermatology and physiology and anatomy and vascular conditions. So it's all encompassing, because a patient doesn't sometimes come in with just one problem or one condition. It can be multiple problems. So yeah, will certainly, you certainly have to see that patient. Yeah, I lost my train of thought again.
No, you got it. Yeah,
Yeah,
yeah, yeah.
yeah, that's you see, I don't know what we were talking about. I was just
About the
rambling on.
uh, podiatry becoming like such a specialty that you really focus
Yes.
on that body part and get all the details.
Yeah, you know, and you're always learning. You're constantly you what makes doctors great, first off, are is their attitude and their pride in what they do. And our office runs very well. I take tremendous pride in what I do. We all do. Our entire office loves doing what they're doing, and it shows. So when someone comes in, they immediately know that I'm there for them to do everything possible and in my power in order to not only gain their confidence, but also get them better, improve their problem, solve their problem, and get them back on their feet as quickly as possible. So, yeah, the fact that we specialize in one particular area of um, of the lower extremity kind of gives us that edge. We're the ones to see for foot and ankle problems, hips, knees, shoulders, elbows. Um, I don't do that. That an orthopedist can handle that and do it very well, but I don't know if anyone can take care of feet better than a podiatrist.
Exactly, exactly. And I want to also touch on that because yes, you're specializing foot and ankle, and there's it's I, I keep saying that, but like people don't realize how complicated it is understanding the biomechanics and how much knowledge you have to operate on someone, from anesthesia to rehab and the healing process and different techniques. But also, I want you, if you can, like also give us an idea of systemic conditions, because the listener may hear foot and ankle and say, okay, but it doesn't even know where my heart is, and that is not true. You may see some vascular issues associated with some advanced diabetes, and you're looking at systemic conditions. Someone all of a sudden they're like, oh, I'm losing strength in my legs, and you're the one that will catch like multiple sclerosis, some autoimmune
That's
conditions,
right.
some neuromuscular disease. So tell us a little bit about that.
Yeah. Again, everything is multifaceted. So, yeah, you need to know your anatomy and you need to know the foot and ankle. But when someone comes in, I don't just look at the foot and ankle, I look at the entire person. So, um, first off, I'll start with diabetes because it's something that we see pretty much every day. Diabetics are at high risk for limb loss because of the lack of blood flow. Sometimes, if they don't take care of their blood, um, their glucose level, and it's constantly high, they can have um, problems associated with the arterioles and the capillaries and the small blood vessel. They can develop small blood vessel disease and put themselves at risk. Not only do they lose the circulation into their foot, they lose the sensation into their feet, and that's sometimes as bad a problem, if not worse, because they can actually have an injury to their feet and have no idea that it happened until it's too late, when an infection ensues and they come to see me, and it at that point they have a terrible infection that needs to be drain, needs IV antibiotics, and needs to be operated on, and sometimes can lead to limb loss. So we also see patients with neuropathic problems, um, uh, uh, Parkinson's and MS, and you can, just by watching someone's gait, you can get an idea as to what's going on. Of course, neurologists in that regard would that's who they would be following up with, because that's their specialty. But when someone comes in and I see something like that, it's something that I can immediately help with the diagnosis and get them on the right track to see the right person for recovery. And then, of course, I'm a dermatologist too. So people come in with dermatological conditions. A patient with psoriasis can develop psoriatic arthritis. A patient with gout can develop gouty arthritis. So those are systemic conditions that will affect the feet, and a lot of people sometimes lose their mobility. They have a difficult time reaching their feet because they have back problems, or they have knee problems or hip problems, and they just don't have the same mobility that they once had. So they need someone to help them out, and um, that's where we would come in. I always tell my patients that it seems as we age, our legs get longer and our arms get shorter. So we can't really reach our feet. That's where, that's not true, by the way, but it seems that way. But when people need help, we're here to help them. So there are some systemic conditions that you always need to be aware of, and diabetes is probably the number one thing that we see that can create these sometimes catastrophic problems with their feet.
Yeah, yeah. So there's a lot that goes in the patient's general health, state of health, and obviously the environment that they're inserted in. So again, people are looking at the clinician and thinking that, like they're seeing you're just focusing on one problem
Right.
and you're looking at 10 different things at the same time. So for the listener again, Dr. Cook, if I, come to you and I'm like, Dr. Cook, I'm just gonna operate with Joe Blow. He operates in his mom's room, is way cheaper. Like, explain what's the difference between operating with Joe Blow in his mother's bedroom, like weird degree that nobody knows where it comes from, versus
Yeah.
actually like seeing a surgeon with 40 years of experience like yourself.
Yeah. Uh, be very careful. I unfortunately, over the years, I, I've had to repair other surgeons' mistakes. Um, and you have to be careful of who you're going to have performing surgery on you. So you want to make sure that they're educated, they're experienced, they're board certified, they've had training. You definitely don't want to go to someone's garage to have your feet fixed, because yes, they may be less expensive, but there's a reason they're less expensive. You get what you pay for. And um, podiatry, that's what we do. That's our specialty. So if someone is offering something for a fraction of the cost, and if, by the way, if they guarantee anything, that's not good, because there's no such thing as a guarantee. You do the best that you can certainly do, and thank goodness, knock on wood, my results have been outstanding. But um, if someone's guaranteeing that their results are going to solve someone's problems, be very careful of that, because there's no such thing. That's not true. Um, I think that you should be very careful of who you choose, and you don't have to choose me, but you certainly want to make sure that surgeon is skilled, educated, and with experience and board certified for sure.
Yeah, yeah. I'm glad you said that. I remember it's possibly the only surgery I had, or one or two, something like that in my life. I had a wisdom tooth that was impacted and pointing down. And the dentist told me you have to go to a facial trauma specialist because this is complicated. They can tear the trigeminal nerve, during the excision.
Yes.
And I got a little worried, and he scared me. He's like, I'm not gonna touch you. This is
Yeah.
complicated. And I was like terrified. And when I got to the surgeon, to the facial trauma specialist, he was super relaxed. And he's like, that's how it is. I'm gonna come in, and what I do is I cut in half, and I open some space here, and I cut out a little piece of the mandibula, and I asked him, I'm like, he said something about a risk of like tearing the trigeminal nerve. He's like, that's correct. That's a risk.
Yep.
And I asked him, how many times have you done it? And he's like, I've done it a million times.
Right.
Never tore
Right.
the trigeminal nerve. You
Yeah.
know, so it's one thing promising result, right? It's one thing saying, I promise this is not gonna happen. You'll be fine, and it's a completely different conversation. Like, look, there is a risk. It runs really close to where we're getting into. You need to be aware of it. However, I've done it 1,000 times. So choose
Yeah.
someone that have done it 1,000 times,
That's
because
right.
so
Being a good physician is knowing what you can do and what you can't do. I'm hopeful. Look, if somebody comes in and I see something that is um, that I'm not comfortable with, then obviously I'm going to send them to the right place, and that separates a good doctor from a bad doctor. You have to know what you can do and what you can't do, and if you can't do it, you send them to somebody who can. If they need a specialist, whether they need to see their primary care physician or an endocrinologist or a rheumatologist or a dermatologist for certain things, you never be afraid to send somebody to that doctor, because if you're not comfortable with it, if you don't know how to do it and you're not skilled at it, you certainly don't want to just take a take a stab at it. That's not good. I don't want that. I always treat my patients as if they're my family, and as if I were the patient, because I want the best possible treatment. I certainly don't want to go to a doctor and, how many times have you done this? Oh, this is my first one, or I guarantee it will be okay. That sends up a red flag, and you should run for the hills.
exactly.
But somebody who has the experience and they're comfortable with it and they know what to do and they've done it a lot. I mean, I can't tell you how many bunions and hammer toes and ingrown nails and excisions I've done in 40 years. I just lost count. I do remember the other day somebody asked how many of these ingrown nails here in the office I've done, and I said, I honestly didn't know. And then I started to do the math, and it's in over 10,000 ingrown nails.
Wow.
It's very routine.
Yeah.
So you want to go to somebody with experience like that,
Mhm.
somebody who it's very second nature, just like your oral surgeon who removed your impacted wisdom tooth. It was no big deal for him because he's
Yeah.
done so many.
Yeah. Yeah. Dr. Cook, time flew, and this was supposed to be a short episode. We're kind of running out of time, so I would love if you could tell the listener where you're located. Tell us
Sure.
just final considerations, where your practice is, how do they find you?
Yes. My office is located next to Baptist Hospital. It's not in the hospital. It's just east of the hospital and next to the Miami Cancer Institute. The building is called the Nomar Professional Building. I've been here for about 25 years. At 8955 Southwest 87th Court, Suite 108. It's in Miami, 33176. If you wanted to see some of my pre-ops and post-ops, I have quite a few pre nail laser. I treat a lot of fungal nails. You can go to Michael R. Cook DPM LLC, and you'll see me, and you'll see my office, and you will see those things that I just spoke of. I'm welcoming new patients. I've been doing this, like I said, all the end of July will be 40 years. I'm not slowing down. Matter of fact, I'm full steam ahead. I like what I'm doing too much, and I'll just keep doing it until one day I don't want to or I can't.
Amazing, amazing. It's been a pleasure, man. Thank you so much for coming in. We'll put the information written so they don't have to like pause the video, re-listen. So, we're gonna cut the videos in small skits. So this one can be like one separated from the others with information on, your address, your practice and everything. So
Right.
I'm
Diogo,
gonna,
thanks. It was great.
yes,
I always enjoyed chatting with you.
same here, brother. Thank you so much. I'm gonna stop the recording and we can say goodbye to each other.